I'm joined today by Jennifer Ban, who's a nurse practitioner at the Phoebe Memory Assessment Clinic. So we're going to talk today about your brain health, about Alzheimer's and dementia. First, Jennifer, what is the Phoebe Memory Assessment Clinic?
The Memory Assessment Clinic is an extension of Georgia Memory Net, and we specialize in early diagnosis and treatment of Alzheimer's disease.
So if I or someone I love, if we think we need a memory assessment, what do we do to get an appointment?
First, you need to talk to your primary care doctor and express your concerns, and they'll decide if a referral to our clinic is appropriate, and then we can make the appointment and get you in for testing and imaging.
I think all of us at some point think, man, I'm forgetting things. Why? How did I forget that? Why did I forget that? What's the difference between just, normal forgetfulness that happens every now and then and true early signs of Alzheimer's or dementia?
So we all forget, we go in a room, can't remember what we went in for, can't find our keys, can't find our phone. But when it really starts impacting life and you need assistance to do things, driving, managing your medications, things like that really become more of a safety issue for a patient, then it might be time, for testing and evaluation for Alzheimer's disease.
So what really is Alzheimer's disease and what are the risk factors?
It's a degenerative disease, and risk factors, some that we can't control, like family history. It occurs more often in females, so those are things that we can't control. But some of the risk factors that we can control are smoking, avoiding alcohol, having a healthy diet, exercise, chronic conditions like high blood pressure, diabetes, strokes, all those types of things put us at a higher risk for Alzheimer's. So managing those conditions well can help cut your chances.
If we come in for an assessment, how do you assess? What kinds of things are you looking for or testing for?
So we do a full battery of psychometric testing. It tests all the different domains of the brain that are affected by dementia. The different parts of the brain that control how we create memories, language, visuospatial. We test all of those different areas because different types of dementia, you'll have deficits in different areas. So it helps us pinpoint what type of dementia you have. And we also use that, we correlate that with MRI images so that we can make a diagnosis.
So if we do get a diagnosis of early Alzheimer's or dementia, what can we do to try to slow the progression of the disease?
So a big one is managing the conditions that you already have. So if you have high blood pressure, having your blood pressure controlled, eating a healthy diet, better control of your diabetes, all of those types of things, depression and anxiety, trouble sleeping, all those things, if they're well managed, they can help reduce the symptoms.
So are there any new developments, new treatments, exciting things on the horizon to treat Alzheimer's?
There's a lot of research. There's more information, research going on for biometrics so that maybe we can get to a blood test one day to check for Alzheimer's. And currently there's an infusion that became available last year called lecanemab. There are a lot of criteria to qualify for it, but it is an infusion that helps remove the amyloid, which is what causes the plaques in the brain that are associated with Alzheimer's. And that's an infusion every 2 weeks that's now available.
Well, this is certainly a topic that affects so many people, so we appreciate you sharing your expertise with us today.
Thank you for having me.